Good afternoon, everyone. My name is Keith Marzullo, and I'm fortunate to be the Dean of the University of Maryland's High School. Welcome to our panel discussion, which we're calling Engaged, Considering Technology and Access for Older Adults. Information communication technology is already deeply embedded in our lives, and the COVID pandemic has only accelerated our reliance upon it for our professional, social, and personal lives. Our jobs, our health, and our social network all depend on such technology. So how is this working out with older adults? This is a complex topic and brings up questions of accessibility, design, utility, pricing, and education. We'll be covering questions such as these in today's panel. It is my great pleasure to introduce today's moderator for our panel, Dr. Jennifer Goldbeck. Dr. Goldbeck is a professor in the iSchool and also holds appointments in the Philip Merrill College of Journalism, as well as in the Department of Computer Science. She is widely recognized as a leader in social media research and science communication. Her work focuses on how to enhance and improve the way that people interact with their own information online. Jen, I hand it off to you.
Thanks very much, Keith, and thanks everybody for joining us today. I'm really excited to be moderating this panel. So just to give you an overview of how we expect this to go, I have a couple prepared questions for each of our panelists. So we'll start with them introducing themselves. I'll ask my questions. And then as we're doing that, I would love to hear your questions. So as Keith mentioned, if you can use the Q&A feature to pose questions to the panel, that would be great. I'll also be monitoring the chat. So if there's any kind of quick things that come up that you want to mention in there, I'll be able to jump in, or maybe the panelists will jump in, but we'll have a record of those. But if you have questions to pose to the panel, we'll definitely be monitoring the Q&A, and we'll pose those questions to them at the end of today. So with that, I'd like to start and have the panelists each introduce themselves just really briefly before we jump into the questions. Amanda, why don't we start with you?
Great, so I'm Amanda Lazar. I'm an assistant professor in the College of Information Studies, and my work is at the intersection of human-computer interaction, which focuses on design of technologies in ways that meet the needs of the people who use them. And my work also lies within health informatics. And I focus on the design of technology for and with older adults and people with dementia.
Great, thank you. Just going in order that I see all on my screen. Galina, why don't you go next?
Sure. Hello, everyone. So great to be here. My name is Galina Majar-Fritz, and I'm a faculty program director at the iSchool. My work is focused on supporting well-being and quality of life of older adults with cognitive impairments through the use of technologies.
Thank you. And finally, Unshim.
Hello, everyone. Good afternoon. It's so good to see you virtually. I'm Unshim Nam, professor and program director for the Nursing Informatics program at the University of Maryland School of Nursing. My program of research focuses on using digital health and telehealth programs to improve the health of older adults and to manage chronic conditions that are prevalent in older adults. Clinically, I practiced as a gerontology nurse specialist, and later on, I gained additional expertise in healthcare informatics and served as a system administrator until I started my tenure as a faculty member at the university. Thank you.
Great. Thank you very much, everybody, for the quick intros. So let's jump into the topic. And Unshim, I want to start with you. We talk about older adults and we talk about technology, but I'd like you to really take us deeper into the question of assessing individuals. What do we know about the people, not just part of this monolithic group, and we're going to break that down a lot today, but assessing individual people's needs, and then the tools that we can provide them with to support them.
Yeah, thank you, certainly. Thank you for the great question. To use technologies for the adults or any users, it is important to assess the first feasibility of using technologies for selected groups, right? And then on top of that, we can think of a number of technologies and the purposes of using them. And they can simply iPhones or FaceTime and so forth. And today, I would like to focus on using digital health program programs for older adults. So in regard to older adults, in this session, I am referring to the population about 60 and 65 years and older. I know in this day and age, many people do not even think think adults who are in their 60s old, right? I mean, they are very active and they are engaged in work. So age is a relative concept. And having said that, so when we use digital health technologies, that's going to be my focus of the technology at this point. We need to keep in mind that older adults are very heterogeneous group in regard to technology competencies. And in fact, many older adults are tech savvy compared to who do not use technologies. But generally though, I think it is important that we understand how older adults have accepted technologies in this digital era to assess their competencies or feasibility of using technologies. So first come to mind is that older adult users late adopters of technologies. So they did not grow up with technologies. So their learning process differ than younger generations who started using computers while they are in kindergarten maybe. And second, as we get older, we gradually experience changes in physical and cognitive functions, right? Such as eyesight and changes in memory. It just changes. And arthritis and tremors a little bit. So older adults develop different usability issues for digital health programs like they may need large font sizes or simple steps to use technologies, but everyone is going through different changes. So we have to assess them individually because they are heterogeneous. But keeping this background in mind, when we plan to use technology, the digital health programs, whether it is a simple form of online resource programs or telehealth programs, we have to consider various factors. It's not just one or two I can pick and kind of explain, because we got to approach this topic using a holistic approach. But still, we can think about some of the main aspects, which include like competency, access, more importantly for our older adults, preferences. So I would like to go over very briefly, I just want to touch base on this topic because each session we can discuss it for one session, but just simply. And also when we think about these various aspects, of course, things depend on types of programs. Some are easier to learn and some are more complicated. So we have to keep those things in mind. But the important thing is that why am I using it? To improve their health in my case, and to do something better or to do good, right? So first, let's think about assessment of competencies. We can start simply asking some basic questions. Depending on the technology in my area is digital health. So I simply by asking our older adults whether they can use email or internet, that's a good start. And they would say that I can use email, then that's a relative concept. You can use the email. What is the level, right? So additional questions, how long have you been using it? And you kind of ask additional questions and also some educational educational years of education can provide you some hint. And then after that, the rule of thumb is that test out the technology. In the academia, we use the term usability testing. So we kind of give them programs and just observe them whether they can use it. And at that point, you'll get a feel about their level of competencies or you may be able to tell, what kind of support they need so that I can help them to use better. So technology competencies, I think we can start from easy because we are working with older adults with different levels and from different backgrounds. So we have to respect the variety. And for access, the other important piece, I think we are going to talk about access later, but very briefly, I simply ask questions whether do they have the technology or have access to the technology. For example, many older adults might not have their own computers or iPad, but they might be able to use their spouse's computers. And I have seen many times, or the children's if they live together. So you simply assess that aspect, and also and when you think about the current status, about 60 to 70% of adults in their 60s have this iPhone. And then for them, this iPhone is kind of major access to the internet. They read them, but not often maybe type it because it's tough. But they use this iPhone as a main right nowadays access to the internet. And those are the individuals who have access, right? For any, for some ways they have access where they live. But some individuals might not have access for variety of reasons, socioeconomic or their choice. But a few provisions can be made if they do not have access to the internet. For example, in our, I just mentioned a couple of them that we use, the healthcare providers use for our patients. So first, many hospitals or even primary care settings, they do have, like we call it a patient or a caregiver resource center. So we provide a computer and access to the computer, access to the internet so that they can find informations, online informations, or they can get the online health information from the hospital. So most hospitals have their resource centers. And then the other provision that we use is that when we see underserved older adults with chronic conditions, and if they are willing to use internet, then our social workers can enroll them into a program so that our the underserved population can have free internet services using the iPhone. So there are several provisions can be made. And of course, also in the community, many libraries have access, right? And actually older adults can use those services. So there are some provisions we can apply. So we will discuss more about this access later. But having said that, offering training is also important. We talked about the competency and access, but the bottom line is though, they didn't grow up with technology, so it is important that we provide necessary training because one can learn to use technology if somebody show them, right? So training is very important, and I can talk about this topic the entire session because I used to serve as a computer teacher in community centers or churches and low-income housing. But the many older adults, really, I have seen it, that they really get a pleasure out of learning because it's a new challenge and they can really learn to use it. It's just a matter of complexity. They just need to do the work, something that they want to accomplish. So it is very important to provide the appropriate training. And of course, there are some skill sets needed to teach our older adults who are unfamiliar with technologies. That's another talk. But I gotta tell you that it is a joy to see twinkle in their eyes. And of course, sometimes they get frustrated and sometimes they quit. But it's okay. I think that, and also it's important that we let them know that it's okay. It's not a failure. It's just preference, right? But I think it is important that we inform our older adults of the availability of such technologies and what can they offer to them. And after that, they can make choices. But many older adults do not even know what kind of technologies out there and what they can do with them. So I think that our older adults have right to be informed about those. And in the same venue, I think
Actually, let me stop you there, just because you've given us a great overview of a lot of the
Okay.
issues. I want to make sure we have time to
Okay.
get through all of the questions.
Almost done. Yeah.
I will come back to let you pick that
Sure.
back up. You really did do a good job touching on a lot of the stuff that we're going to probe further in depth as we go forward. And so, Galina, I want to turn to you to sort of pick up on this issue of breaking down this population, because we sort of talk about older adults as a group. And as Unshin just described, like they actually have all sorts of different needs and skills and abilities and access. So I'd like to hear you, Galina, talk about like, while each person is certainly different, what are the different groups within here? What are the ways that we think about that? And if there's any that you find, particularly interesting from your own research perspective, talk about the challenges that come up there.
Sure. As my mentor used to say, when you've met one older person, you've met one older person. And I firmly believe that. I think working with a lot of gerontologists, and, we have had discussions that if we classify older adults from the age of 55 to, let's say, 100 as old, we're implying that they all have an overwhelming commonality in that period of life, which is not true, right? I think each of us has a very unique experience. And as we age, there's so many complexities that play into that. So this is a very tricky question, and I will try to answer the best that I can. So in general, I think it's really a mistake to assume that aging is a label that really tells us much about a person. I think most of us feel when they say, oh, I don't feel my age, or when I've spoken to older adults, they'll say, I'll look in the mirror and I can't recognize who that is. I think a lot of us feel that way. And age is just really not a great criteria to use, because there's just a great deal of variability in aging and how we go through that experience. So it's because of the fact that it's so multidimensional. People grow old biologically, psychologically, socially, right? All of those components play a huge part in sort of our aging, our own personal aging experience. And making those age boundaries doesn't really produce any meaningful definitions of what old age looks like. However, I will give you the gerontological sort of breakdown. And in the gerontology literature, we use these terms. And this is also another topic that I think it's really interesting to consider, sort of the language that we use in how we address older adults. And there's been a lot of discussion about whether you'd like to be called a senior or an elder or an older person. So we called the youngest old those who are aged 65 to 74, middle old 75 to 84, and oldest old. So I have never in my experience gone up to somebody who's in their 90s and say, hello, Mr. Oldest Old. This is sort of these kind of, we like to compartmentalize, I think, as humans. We'd like to put things into neat little boxes, but aging is messy. And so when we talk about technology and age and chronological age, it's really hard to say, for those of you that are interested in purchasing technology for your loved one who, let's say, is in their 70s, there's lots of technologies that I could recommend, but I think it's a very unique sort of combination of what their needs are. So one common mistake that we make is that we develop sort of this strategy on stereotypes, on aging stereotypes. So I think those of us who have been in aging for a long time firmly believe that we have to break down those stereotypes in order to move forward. So what you may envision somebody, what they look like or their abilities in their 70s or 80s may not be what what they're like at all. And so understanding every single human being is very difficult, but I think in general, it's just very complicated. So social class, ethnicity, education, all of those components play a huge role in sort of how we look at age. And so if a person, just to give you an example, if a person in their who's 65 now has grown up with a physical disability, that person looks very different from another who has more normalized aging experience at 65. So the perspective that I like to utilize is population segmentation, and we've borrowed that from marketing, and I often view older adults as very educated, informed consumers, as well as their care partners and family members. And so I think really thinking about what are the different components that comprise this person's experience is really critical. So technology adoption for older adults is not a one note call to action. I think the concerns of a 70-year-old are not the same concerns of a 75-year-old. So I think lifestyle segmentation is really an appropriate way to look at somebody's experience and what are their needs from technology, and really matching that those needs to that particular technology. So the way that we talk about person environment fit, I very much believe in person technology fit. And so what works for me may not work for you. And I think really digging into that will give us a more appropriate look at how to really segment the diversity of the older population. So a good example that I've used in my own personal research and sort of looking at that kind of lifestyle segment is the basics hierarchy. It sort of really looks at all of the components of aging, starting from the biological experience all the way to spiritual. And that's the holistic perspective that I also firmly believe in. So when we look at elders from sort of the biopsychosocial perspective, I think that really can inform what type of technology they're interested and what type of technology they need, and how could we match the most appropriate tech to their needs. So the value is really critical. What is the value to me? Does it improve quality of life? I think over and over I see that. What's in it for me? And at that stage of life, if those of you who have been close to elders or have worked with elders, you know that they know what they want at that point in their life, and they will share it. And I think for those of us who are thinking about design of technology, it's important to understand the needs. So it's not probably the best answer about segments. And I can talk about, you know, we've looked at sort of pre-retirees and grouping individuals who are ready to retire, those who have retired. So there's many different scales and as I mentioned, market segments that we look at, but I think grouping individuals by healthcare needs, for example, could be very supportive in terms of what technology they're using. So overall, aging is a very multifaceted experience. So complicated question, complicated answer.
No, that's great. And I think the answers that both of you have given, it's interesting to me, right? Because this is not my research area at all. And so part of the reason I love moderating these panels is that they give me these interesting ways to reflect on, you know, my own experiences and observations. And so Galina and Unshin, from both of your answers, you know, I think about my grandma. She passed away this weekend. She was 91 years old. And she got her first computer probably 10 years ago when she was 81. And we got her hooked up on the internet, and she'd send me emails. And then sometimes she'd get a little pop-up message and she didn't know what it was. So she just unplugged the whole computer from the wall because that made it go away. And it's like, she knew what she wanted to do, right? And she was able to do that thing. The other things were a little shaky, but you know, she could do them. And then, you know, as she, you know, she had her normal decline and went into a nursing home, couldn't really use the computer anymore, but learned how to use Siri on her iPhone. So she started texting me, right? At 89 years old, she started texting because she was able to use that functionality without having to type, without having to do any of the stuff that she physically couldn't do. And it's just so interesting to hear your answers and think about, you know, both these biological and cognitive processes of aging and how they affect the way that people can access technology. But if they have that motivation, right, there's whatever the things are that they want to do, that they'll take advantage of whatever tech supports them for that. So thank you for giving me like those extra insights into things that, you know, I think a lot of us have probably observed. So Amanda, I want to turn to you now. So what we've been kind of laying out here is like, okay, what are the challenges that this group faces as we think about technology with them? And so we've talked about how to break down this monolithic notion of older adults, but I also want to talk about breaking down this monolithic notion of accessibility as a single goal, because I don't even know what it means to make everything accessible. And that's not necessarily the goal, right? My 91-year-old grandma didn't need to type if she had something else to use. You didn't have to make the typing more accessible. So can you talk about this idea of usefulness, which I think, this story that I just shared conveys, but so do, a lot of the comments that Galina and Anshun made, and how does that play into the idea of making technology more accessible for this population?
Yes, so often when we see a lack of adoption from older adults, we think that this is because the technology is too hard for people to use. So we turn to things like accessibility, saying, okay, they're experiencing age-related impairments. How can we make things easier for them to hear or to see? With usability, we say, okay, these things aren't easy enough for them to use, right? They can't find the buttons they need. So how do we make things more usable for older adults? And these are really important. We need to address that. But there's also a lot of literature showing that older adults have very cogent reasons for not using technology. Some of the main reasons that older adults do use technology is when it's useful for them and when it makes things convenient. The problem is sometimes us designers or the people buying technology for older people may have a definition of usefulness that does not align with the population. So for example, I did a study on robotic pets where so many robotic pets you see are targeted at providing companionship for older adults, right? These fluffy, sweet animals that will kind of serve as a social partner. And when we spoke to older people, some of them said, yes, okay, that could provide me some companionship. But a lot of people said, no, I have no interest in forming a relationship with this thing. However, I could see it having a place in my life because I look outside my window. I live in a retirement community where I'm not allowed to have pets, and I see all these people walking their pets. This was in Seattle where there's a lot of dogs, right? So they would see people at the dog park speaking to each other. And they saw a place for a robotic pet in their life as a way to connect to other people with pets. So instead of the technology being the companion, they wanted the technology as a way to form more social relationships with other people. Other examples were having it at a party. They thought it would be a fun thing to have at a party, or even a topic of conversation with their husband, someone they've been married to for decades. So our ideas of usefulness don't always align with the people that we're trying to provide the useful thing for. And other times we can get into trouble when we try to assume that older adults as a homogeneous population will have a single definition of use. And I'll give you another example from my research for this. So I'm looking at the formation of a makerspace, which is targeted for use by older adults. So some people love this idea of using 3D printers and laser cutters and learning these new skills, engaging in do-it-yourself, even learning to code. Some people are really excited by this. But one person that I spoke to said, hey, isn't this just home economics? Like, I've learned this already. When I was younger, my grandparents taught me to sew and to make things with my hands. This has no relevance to me. So for this woman, looking at it through her kind of generational lens, a makerspace doesn't mean the same thing that it might mean to younger people saying, oh, this is going to be a space for people to learn new skills. And I think this relates to some of the opportunities for engagement that we're seeing becoming online through COVID, right? So someone might say, oh, there's a virtual art class. That's so exciting for me. Someone else might say, I did arts when, in the school when I was younger. This isn't interesting, but I want to do a museum program that's available online. So really understanding different people's motivations and what is meaningful to them is key here. So I spoke about usefulness as that first leg of why older adults decide to use technology. There's also convenience as the second. They're willing to use technologies that make things more convenient for them. And this is actually the promise of so much technology, right? So much is kind of targeted at us with the promise of convenience. And here, what's really relevant is research on the hidden work that it takes to make technologies work. So I'll give an example of the Roomba, right? So the Roomba is supposed to save me time, save me all the work of keeping my house clean, or at least the floors, I guess. because it's supposed to just zoom around and do this thing, and I don't have to vacuum or sweep now. But researchers talk about how actually that minimizes the work I'm doing because it beeps every 15 seconds, my Roomba does, because it gets caught on some wire. I actually have a little photo album of all the times that the Roomba like drags something off the counter and I have to go fix it, right? You have to empty the bin, you have to keep it charged, make sure it finds its home. You have to move it from floor to floor, you have to carry it around. So not to say that this means the Roomba isn't a useful tool, I find it very useful, but this does show that there is work that we're not talking about that's involved. And this applies to telecare solutions too, right? There are approaches to put sensors throughout older people's homes that are being used more in some countries. In the UK, there's a bunch of studies about actually implementing these. Here, of course, too, but a little more experimental sometimes. And the idea is that this means that we can address the caregiver shortage, right? There aren't enough people available to take care of older adults. This is how we can help make sure that they're engaging in activities, that they're not falling, that all kinds of ideas for them. But what this sometimes buries is all the work that people need to do to make these work. Keeping them plugged in. When the Wi-Fi drops, getting it back on Wi-Fi. Doing updates, checking portals if those are necessary. We also can forget about the new work that's on healthcare professionals, right? Where they now have to develop new literacies in technology that they didn't have to before. They have to understand how to interpret sensors firing or not firing. And when you get into memory impairment, people with memory impairment, then even more things come up, where sometimes now family caregivers have new and shifting responsibilities and interactions that they did not have before. And sometimes, even for people without memory impairment who aren't requiring a significant amount of support, new technologies can create a major shift. So for example, I have a family member who's been taking care of her diabetes needs for decades, but her blood glucose setup was no longer supported and it became a digital technology. Now her son has to play a major role in her care where he didn't before. So while technology is purported as this way to achieve convenience, if we don't explicitly address or at least acknowledge the kinds of new inconveniences that exist and having programs and infrastructure to address them, we can end up with technologies not meeting the promises that they're making and not adopted and used.
Awesome, thank you so much. And you mentioned briefly the challenges that we're now dealing with COVID for this population. And Unshin, I'd like to kind of pick that up and bring that to you for the next question, because COVID has brought a lot of unique challenges, for everyone. And the way that most of us have solved it, including everyone who's here today, is that we've shifted everything that we possibly can virtually. And that, of course, highlights a lot of the technology challenges that come to older adults, both for their health concerns, which is a space that you have particular expertise, but also in general, and that we're going to carry that through to additional questions going forward here. So Unshin, let's start with you with your thoughts on the kind of healthcare and technology issues that have emerged for these populations, specifically looking at COVID and the challenges that's brought.
Mm-hmm. Oh, okay. I think my mic is okay. Thank you so much for your great question. So I think during this pandemic situation, we can think about a variety of, a number of technologies that we could use, and then we need to make sure that older adults can use them. But based on my current experience with our participants in our study, caregiver online cancer survivor study, I can stress two technologies. The first one is the web meeting programs. I'm sorry. So web meeting programs like FaceTime, because those programs connect older adults, perhaps who live alone with their family members and friends, and isolation really can make our older adults, especially who have chronic conditions, vulnerable. So those FaceTime is relatively easy to use technologies if they have the access to the program, of course, and they do not need specific apps, so they don't need to download. But the other critical example is telehealth technologies. And during this pandemic, many of you might have adopted telehealth visit to your providers, right? So I think at this point that I would like some interaction with our participants. So let's have some interaction here. So we prepared two polls, two simple polls. So Claudia, are you ready to launch the first one? So we have a question for you. So in the past, I think she's gonna, okay. So in the past 5 months, like from April to August, have you made any appointment to see your care providers? Yes or no? I think she's gonna give you about 30 minutes, 30 seconds, not minutes. Just to visit to your providers, it was a difficult time. It's about the time, perhaps? No? Okay. Oh, 74%. Okay, pretty large number. The second poll, it's simple too. So the second poll asks about what kind of technology, what kind of visit methods. If you saw your provider, which appointment type have you used? Either telehealth, face-to-face, because my provider did not offer a telehealth option, or face-to-face, my choice.
While people are answering, I'll take advantage of my microphone to say that I've done
Okay.
both. I have telehealthed with some of my doctors, and I went in to see my primary care doctor in person.
Oh, good. In person too. Okay.
Yep, I was the only one in the office. It was very safe.
Good point. Alone is kind of physical distance, right? by
As
default.
much as I could. Yep.
Okay, I think maybe ready. Okay, let's see. Wow, more than half of the visits were made 50 telehealth visit. It's amazing, isn't it? It shows national statistics for older adults, a national preliminary report just to show that about half of primary care visits were made through telehealth. Before it was before the pandemic, it was 0.1%. So what an astronomical increase, right? So we just made that leap pretty quickly and very fast. So older adults have adopted those technologies because I just provide you with the statistics from the Medicare beneficiary report, right? So I thought that it was amazing. And as you know that many older adults live with multiple chronic conditions and they need to see their providers regularly. During this pandemic, coming to hospitals or clinics itself add additional risks to their health, especially older adults is kind of considered as a vulnerable population. And let's think about the cancer survivors who just completed curative treatment and just that she or he beat the cancer. However, they need to live with lingering difficulties or symptoms at home for a while, like fatigue, pain, most of all, fear of recurrence. So these individuals need close observation, supportive treatment, and more importantly, emotional support. At that time, they really cannot risk getting COVID-19 virus. At this point, they beat the cancer, they gotta keep going. So we can imagine that what could have happened if we do not have telehealth technologies, right? Thank goodness our older adults can use them. And there were some difficulties I can share with you. So if we didn't have the technologies, many older adults probably could have suffered difficult symptoms and experienced downward spiral, depression and anxiety at home by themselves. So it was it could, the situation could have been much worse. So at this time, at that difficult time, providers and nurses checking in and provision of support via telehealth can mean the world to them. And of course, from the health outcome perspective, it's important for care providers because we can assure quality of care and safety of care. But these older adults, some of older adults have never used it, but they adopted it. And some had difficulties. For example, they can use the telehealth programs, but many older adults have difficulty with downloading apps. They can read emails, they can open the link, they can do many things, but they have never learned how to download apps. It was difficult for them. So once they jump the hump, they enjoy it and they really appreciate technologies. So bottom line is that, technology, we can help them, and older adults have some difficulties depending on each individual, of course, but it is important that we provide the right support and training so that they can overcome them and can get the benefit of them. Of course, if they don't like it, it's all right. They don't have to use video-based telehealth programs because we can go down. There are low-tech and high-tech. Technology, phone call is a technology, right? And then the Zoom, secure Zoom is a technology. But as a provider, I have to decide which one is best to fit for them, as previous Amanda just explained. So I think it is important that we kind of consider, as Amanda said, both, users and then the technology, and make the fit and make them get the benefit out of it. So I think one more thing that I want to emphasize is that, so far we use the technology, telehealth programs like the baptism by fire. But what we need to do is that we need to do more work so that we can develop and establish the best practice to provide this telehealth with the training so that our older adults can the best quality that telehealth can use. So I think I can stop there.
Great, thank you. That's great insight. I also want to thank everyone who's putting questions in the Q&A. You have some fantastic questions, so we're going to have a really good time when we get to those at the end. So just a little ping for everyone else that if there are questions that are coming up, plop those in the Q&A, and I'm kind of combining some that touch on similar things, so we should have a lively session. But Galina, I want to come to you. So one thing that shocked me when we first had started talking about this panel and I was doing some research is that I looked at a study from Pew that looks at internet access, and I was astonished that they said 27% of people over 65 don't use the internet at all. I was astonished that it was that high. I thought it was maybe 5%. And so that means, all this kind of telehealth options, like almost 30% of older adults don't have access to that. And that's not even talking about, what sort of connection do they have, right? Do they have a nice computer and a broadband connection and all of that or not? So I'd like you to talk a little bit about how this issue of access, whether it's internet access, whether it's the kind of technology that they have in front of them, how does that impact the kind of technology that we designed to support this population? And I just want to note that access means both, some older people may choose not to have a high-speed internet connection in their house, but some may opt out, right? I don't want to use that thing, don't bring that thing in here. So there's access, from a practical perspective and from a choice perspective. How does that lack of access for a lot of this population impact the tech?
Sure. That's a great question. And it really boils down to what we've talked about, which is value. What's in it for me? Do I think I'll gain something from having internet access and being able to have an Alexa in my home and ask for the weather? Or is it just yet another shiny new thing that's just going to collect us in the corner? So for me, and working with elders, it's always been do I find it valuable? And can you show me that there won't be any barriers for me to use it? So we know that so many elders want to stay at home, and that has been my focus of research and practice, has been really supporting older people in their home, whether they have cognitive impairment, whether it's a multi-generational family, but really what are some technologies that are practical, that are on the consumer market, that are affordable, that could really support somebody living in their home as long as possible. And we're seeing drop of occupancy rates in retirement communities and institutions. So we know that everyone is trying to stay home as long as possible. And so that the idea of connecting and having access is really important. And as one person, I don't have the answer, but I think it really boils down to really finding the technologies that are that don't have barriers. And so working with older adults and families, could say, here is a Google Home. It has so many great options, but you have to get internet access first. Well, that's a great, that's great in theory, but let's talk about cost. Let's talk about, do I have the ability to have Wi-Fi in my building in downtown Baltimore? So it's so complicated, and it just really depends. And I know it's not the answer everybody wants to hear, but if we are thinking about this on a broader scale, there is some really great work being done where we are trying to connect elders to low-cost broadband services through AARP or Verizon or Comcast. But once again, what is the value? Would they find it helpful to have that in their home and be able to have all of these connected technologies? So for me, sometimes I'm sort of the salesperson to a family where one person, let's say has mild dementia. So I have to sell the technology and really talk about what are the capabilities. And with voice, it's great. I love voice, and I think it can be really impactful, and there's no buttons, and you can sort of express yourself quite easily. So making the sell, I think, is really important. And for elders, for me, it's really what's a must-have and what's nice to have. And when I've done research with voice, some of the Alexas that I've installed in elders' homes will just collect dust because it's a nice thing to have. Sure, it tells me the weather. But for others, they really find the value. And what I had noticed is that the value is not as dramatic as some of us may think. Sometimes it's just dictating your grocery list and being able to have that spoken back to you, something as simple as that. So I think there's lots of barriers that we have to overcome. And those who are designing technologies and those of us who are thinking about, well, what technology should I purchase for a family member? We have to look at what's, what's intuitive, what's well supported. I talked about forced obsolescence. There's always updates. If the grandchildren are not around, who's going to help with the updates? And it's interesting. I just had a conversation with a colleague who was asking me what my suggestion is for the best digital photo frame for her grandmother. And I said, well, there's so many options. And, I gave her this comprehensive list and, all of the different options. And she said, okay, well, I just need to be able to upload photos remotely too. And that's really kind of the only thing that we need to have so she can see pictures of the grandkids. And I said, well, I probably should have asked that question. What are you trying to do and accomplish? So I think eliminating a lot of those barriers is really critical. And like I said, there's plenty of really wonderful consumer technology that's affordable and easy to use that may not have been designed for elders in particular, but can be really impactful. So I'm a firm believer of, as I said, person, environment, fit. Not everybody needs a Ring doorbell, but if you are somebody who has mobility issues, installing that Ring doorbell can be really powerful and can give you insight into who's in front of your door and whether you should get up and open the door. Or smart lights, for example. In some of the homes that I worked with elder couples, some said to me, we don't want smart lights because we want to be able to get up, walk around, and turn those lights off. So don't put something in my home that's going to make me sit for longer. And those are aspects and things that I really never thought about. So I think the unique thing is to sort of present the capabilities of technology, and I think and everybody sort of utilize it in their own unique way. But it's a huge challenge in terms of connecting and what are, people think about the trade-offs. So for somebody who's in their 80s and really has no interest in having internet access, I will not try to make that sell. I think they have a perfectly good solution. They have a great network of friends, and they'll go, get on the bus and go see their doctor instead of do a telehealth visit. So I think I love the idea of DIY technology as well, sort of kind of combining things that are useful for you and really kind of utilizing what's most important. So in general, it's really kind of complicated, but I think if we think about what is the value and what's the need, what does this person gain from using this, we can kind of get past some of those barriers of connection.
Thank you so much. So Amanda, just like I had kind of Unshim start, and she really laid out this full space of things, I'm going to give you the opportunity to do a wrap up for us. I'd like you to think about, say, what are the biggest challenges that you see in the space of technology for this generally aging population? And if you have specific thoughts on how to relate that to COVID and all of the challenges that has brought us this year, I think that would be a great way to kind of wind up the formal answers and then move on to questions from everyone else.
Sounds great. Yes, so like we've been hearing, access issues are immense. So infrastructure issues, cost issues, the things we've been speaking about. And there are 2 points that I'd like to add that I don't know if we've touched on as much, which is one is a quote that I've made up that I like to say, which is that technology is not designed for older people's fingers, for older people's eyes, for older people's brains and souls, I guess. Maybe I'll add to that list. And what I mean by that is that technology is created by and around the needs of younger people, right? If you think of who are the people creating technologies, we know the tech industry skews really, really young. So a technology that's made, the people that they bring in to test their technology on are often default younger. So there's so many changes we may need to make just to make it accessible and usable for older people. The problem too is that when we do consider older adults, we often design off of this vision we have of what an older adult looks like. Sometimes, and that's heavily influenced by the way media represents older people, by the way we relate to grandparents, people generations older than us sometimes, or our parents, which is very different than actually being an older person, right? And because of that, sometimes we as a society spend a lot of money and a lot of time in a direction that actually doesn't make sense. So for example, medication reminders are so often designed around the idea that people are forgetting to take their medication. Some people do forget to take their medication, but these medication reminders, we still haven't solved this problem of creating technology that can help people take their medication on time. There are some kind of clever hacks, people have come up with some very individualized approaches, but we haven't solved this problem. There are a couple of reasons for this. One, medication reminders are often big and bulky, as in we have a baked in assumption that people don't leave their homes, that they're home all the time. They're not going on vacation, they're not visiting people, they're not hanging out, they're not doing those things. But also, this idea that is built around memory means that you can remind someone all you want, but research has found there's other reasons people aren't taking medications, which include that the physical symptoms makes them feel bad, or identity. People don't want to have the identity of someone who's sick. So if we're working based on our ideas of what it means to be an older person, we can end up going down the wrong path. So we need to work with older adults to speak to them, to understand why they're not using particular technologies. User-centered design is one philosophy from my field, which people really like, right? The idea is that you actually just go to them and speak to them. Why aren't you using this thing? And you act accordingly. But we're still constraining the problem, aren't we? I might be saying, why aren't you using this medication reminder? I'm not saying, what do you need? So there are some movements which are led by the end user themselves. For example, Innovations in Dementia in the UK has a very novel program where people with dementia are the ones distributing funding. So they have pockets of funding and people come to them with the projects they want to do and they decide which projects to fund. So that's a significant shift, right, in who's defining what's going to be done. The other thing, point I want to touch on is that sometimes we can get so excited about novelty, we get into these utopian visions of the future, like, oh, once we have virtual reality, no one will be lonely anymore because they will have all their friends right there with them in 3D, or artificial intelligence is going to be able to predict everything and give us everything we need. And it's really exciting, the potential for future technology. But there's a couple things here. One is that these visions leave behind current generations, current people who have needs that are not going to be met for the year or 10 years or infinite amount of time until the technologies can do what we want them to do. The other thing that these visions do is they lose sight of some of the nitty-gritty, less glamorous aspects of using technology. So I can develop a really cool VR program, but if someone can't set it up, or they don't remember to do the activity in the first place, even though it's sitting there in the room, or they can't connect to Wi-Fi, then it doesn't really matter that I've solved this problem of loneliness. So there's a lot of less glamorous problems for us to work on and pay attention to and get excited about. And even with an eye to the future possibilities, we also need to ensure we have alternatives available to people who don't currently have access, rather than letting our minds skip to the point where everyone has access. So there's a memory care program local to our region that has shifted all of their programming online with COVID. And they have Zoom rooms with different kinds of events. And this is great for the people who have Zoom. But what they've also done is they have a phone program where they call someone. They actually call people and speak to them on the phone if they don't have that Zoom access, right? And they're thinking of other creative ways that they can ensure that people still have things to do, even if they can't get on that Zoom call. And there's also innovative things that we can do with existing technologies if we get creative about it. So I have a colleague, Robin Brewer at University of Michigan. She's doing really interesting work about how older adults can access online information and social support through phones. So she's created this phone-based blogging platform where you can, older adults, originally designed for people with vision impairments, but I think she's expanding it to older adults more broadly, especially with COVID, can do these things that we often associate with an internet connection from their phones. And then on the more practical side of things, she's also studying a phone-based virtual senior center.
Awesome, thank you. So, okay, let's move to the questions from the audience. They're so good. Thank you all for the great questions. A lot of them that I've seen both in the chat and in the Q&A are people who want some real help. So I'd like each of you in turn, and we'll do Amanda, Galina, and then Unshin. I want specific websites that you think will help people who want to help their parents or their grandparents get online. Training programs in any place that will help them learn how to swipe left and swipe right. Websites that will show you how to enlarge the font. You know, someone had asked, do you have suggestions on particular devices? But I think all devices actually have this capability built in, make the font bigger, a lot of these accessibility things that will work for older adults. Where can we go to find, tutorials on how to use things like that? And one thing that I had mentioned in the chat to someone that I'll just start with before I let all of you give your much more informed answers, is that we have a group on campus called the Trace Center. So it's trace.umd.edu. I will plop that in one of the answers so you all have it. But they have some interesting programs where you can kind of configure a computer and then have it so so say if you're sharing a computer with a parent or a grandparent, you can have it so when it logs in, it gives them all of their settings and they don't have to worry about doing that configuration themselves. There's a lot of interesting programs there. So I'll link that while all of you give answers. And Amanda, let's start with you.
Yes, so towards the end, I was talking about turning over to older adults themselves, or I spoke about people with dementia, to define what is even the technology of interest to them. And I can share a group called Longevity Explorers. So this is a group of older adults who decide what technologies they want to talk about, and they actually produce guides. And these guides include, are you interested in voice assistants? Here's how to get started. Here's what might be right for you. And they have something on medication reminders as well. I saw a question in the chat about, okay, great, now that we know they don't work, what do we do about that? So I would refer people to go to the Longevity Explorers and look at some of the things that they're putting out there, what this group of older adults is saying that are the technologies that work for them.
And I'm going to be live posting these links in the chat to everyone as you guys are talking. So I just put in a link to Longevity Explorers in there. Galina, any tools you want to recommend?
Sure, I think that's a great tool. I would suggest, and I have followed Lori Orloff's blog for many, many, many years. I mean, she is a veteran in aging and technology, and she really looks at all types of technologies on the market for elders and produces these really informative reports that are really written very well. So they're not for researchers, they're just for the consumer, and they're really wonderful. So every year, every so often, she'll put out what is out there and what is helpful, who should read this report. So I would very much suggest her blog, and also AARP. It's a great resource. I know that in the past we may have felt a certain way about AARP and what they represent, but honestly, it's they have a lot of resources, and when it comes to technology, they have so much on their website. So I would suggest those two resources.
Great, thank you. Unshim, do you have any additional resources to add?
Yeah, I think actually both presenters mentioned good technologies, and seniornet.org has the learning centers in many states, and they do a good job in educating older adults how to use computers. And then NIA and NLM developed heuristics for designing principles. And of course, AARP has some games. But I tend to develop our own manuals for our participants, develop manuals and teach them kind of.
Do you have any of that available or online, or is that really specific to your programs?
Not online, because technology changes all the time. So I constantly update when I have like teaching sessions. And I do share with the organizations.
Great. Thank you all very much. So good. And like I said, in the chat, you can find links to everything that everyone just mentioned. If other links come to mind as we're going through these questions, just go ahead and add that into your answer, and I'll add them back into the chat. Okay, so there were a few questions about sort of design and representation. Amanda, you kind of touched on this in your last answer, but this question, how can we address the tech industry's lack of representation of elderly people in the design process? What kind of efforts have you seen from industry to provide tech that meets an older population's needs and intergenerational needs? So Amanda, I'm gonna have you start, but Galina and Unshin, if either of you wanna chime in, just give me a little wave, and then I'll go to you when Amanda's done.
Yeah, so this is hard because this is a societal attitude problem, right? This is embedded. Our society is deeply ageist, right? From the people we see in movies to the anti-wrinkle ads, that to the Botox that people start getting at really increasingly younger ages, it seems. So this is a deep issue, and we can all become anti-ageism evangelists. We can follow people like Ashton Applewhite, who is an anti-ageism kind of speaker, has books on this, learn of where it appears in our lives and work through that. And in terms of tracing it to technology further, there is so much research on how people, older adults, will reject a technology that could be extremely useful for them because it signals a frail, a lonely, a negative thing that no one wants to be associated with. So think of the Life Alert ads, right? I've fallen and I can't get up. If someone's saying, hey, mom, you really need to start using this, do you want to be that lady from that ad, that helpless person? Of course not, right? So technology, that starts from there. But I guess something that we can do is when we talk about technology, if we're trying to encourage someone to use technology, think of the language we're using. Are we saying, hey, this is to help you? Or are we saying, this is to make me feel more comfortable, maybe? I want to make sure you're safe and it's going to help me. Not, we need to keep you safe, right? So the framing we use in an interpersonal level, but also if we're involved in marketing efforts or talking about things about our programs, being really conscious of what things are signaling to people is super important.
That's a great point. We had this issue with my grandmother, who I mentioned. You know, she ended up in a nursing home, but was in her house for a while and really needed some kind of thing, would not wear one of those life alerts. And while I will not have an Alexa in my house, that ended up being the solution that we got. So if she fell, she could yell to the Alexa, because she was okay doing that because it didn't have the connotations that wearing the button would. So it's not even that it was a better solution. It's just that it was one that she was willing to use. So that's so interesting. Thank you, Amanda. So we have another question, and I'm not sure which of you is best to answer this. So raise your hand or else I'll pick one of you randomly. From Emily Wagner, who says, thanks for a great discussion. I'm a librarian who's really interested in older adult tech use. Can you talk a little bit more about the element of information curation as a part of tech use for older adults? How does this factor into their adoption and user experience? Are any of you enthusiastic to take that one on?
I think it'll be great. Information curation can mean many things. So it could be simply like information chunking, literacy issues. It could mean those things. Those things are the whose question is that? Information. So it would be great if we can clarify a little bit about what the information curation meant.
Well, so let me just add to that, because there's a couple other questions about this. You know, I think some of it is, can we pull together a bunch of resources? I mean, sort of what we're doing now in the chat, though it's not for older adults, right? Like, let's curate a bunch of these links in one place. But there was also a question, for example, on misinformation. So if we're looking at, like, you know, political issues with older adults, is there a way to kind of curate information to help them better deal with disinformation, misinformation that may be coming at them, that they may not have developed the skills that those of us who grew up with the technology have to kind of sort that out? So I think it's a pretty broad question. So any part of that you'd want to take on is...
I can kind of briefly start. So I think what we learned, we asked those questions to our older adults surveyed. And first of all, older adults will tell you, I need to be involved in technology development. We have heard that. And then the other aspect that we learned is that they trust like providers, they trust their relatives. So I think that, and from that regard, they appreciated structured like online learning module as opposed to just going to using the Google. So I think curated some repository, but the source, it could be healthcare organizations, or it could be agencies or university settings. But again, that information needs to be disseminated. And also I think that's it is important that we have backup from at the policy level and funding level, so that we can inform our consumers, and also you know, can really facilitate that type of work, you know. So it's a multi-pronged approach, but I would think that structured information constructed, curated by credible source is going to be really helpful, and they appreciate it because it's kind of first line screened in a way.
Great, thank you. Let me throw another very practical question. Adele says, my mother with dementia and who's in her 90s needs a user-friendly FaceTime vehicle. Any suggestions? Amanda or Galina, you have favorite FaceTime vehicles for a 90-year-old? I see neither of you coming off. Oh, there we go, okay.
So I can't say for sure what works well. I know some people have tried using the Show, that like the Amazon Show, so a voice assistant that has a built-in screen. So it's on one kind of thing and someone can bring calls in. And then I do know people are trying some different approaches. So I definitely can't speak for them, but for example, OneClickNet is trying to address the issue of having to kind of have accounts. They're trying to make it simpler, a one-click kind of solution. So those are two that I would raise as having different features that might be useful.
Galina?
I would say I most recently spoke to a couple that I had worked with where one partner has dementia, and they actually they have the Echo Show, which works really well. They get to call their friends who also have an Echo Show, so interoperability is a bit of an issue. But they actually purchased the Facebook portal and absolutely love it. It's actually really unique, and I chatted with them through the Facebook portal. So essentially you can call somebody through Facebook Messenger, and a lot of us, most of us have that. So it's really easy to use, and it's very interesting where you can put it up on the TV. So it's big enough where you could just be in your home. It can follow you around while you're talking to somebody else, if you remember those commercials through Facebook. So I think that's a unique one.
Awesome. Thank you. Here's a good question. How can I help my parents get over the fear of technology? They're scared that they may break the computer if they click the wrong link or button. I gotta say, I have that problem with my undergrads too. I mean, I think this question of being comfortable exploring technology, like tinkering with it, trying stuff, that's something that faces people of all ages trying to get comfortable with technology. But of course, as we've outlined today, you know, this can be a bigger challenge for people who didn't grow up with the tech and kind of came to it as adults. Do any of you have thoughts on, you know, some simple steps to take to be like, it's okay if you click the wrong button. You could just unplug the thing from the wall if you have to. You're not going to break anything. Amanda, you want to jump in on that one?
Yeah, so I think I'm hoping Unshim has some great stuff to say from your experience as a computer teacher. But I have found, so haven't studied this extensively, but I just get a sense that voice assistants, for whatever reason, people are a little less hesitant. There's other issues, such as people might forget the keywords to use, things like that. But people seem to be more willing to just try random things with a voice assistant than a computer. So
that's great. Unshim, go ahead.
Yeah, I teach older adults who never used a computer. Then I don't even use the terminals computers. I will just tell them there's a box and that it has memory. And from the beginning, I just tell them that you're not going to break it. Just explore. That we start from there. You will not break it, just explore, hunt and peck. So make them, put them in each first and let them know that, you know, if something goes wrong, we can fix it, but they're not going to be really breaking it. They're going to really, you know, sophisticated younger generation might do something, but, you know, older adults who are not familiar with the computer, who are learning it, they just need to be comfortable. Just let them know that, you know, you can hunt and pack, you're not going to break it. It's okay, it's just a box. That's what I would say.
I mean, you have to sort of remember that, like, even if you did something and you don't know what it was and it made the screen you wanted go away, like, you can just start over. Like, don't get mad at it. It's not telling you you're dumb. You know, that's a hard thing to get across sometimes. Yeah. All right, here's a future looking question from Jim Lovell Ford. As a 66 plus person, I still like to do tasks involving the upkeep of my home and helping my kids. Think deck building, building retaining walls, French drains. I recently had an accident and wound up straining my body beyond its capabilities. What accessible tech can we hope for, like exoskeletons or dollies with winches, that would be affordable and easy to use? So this is kind of future looking. You don't need to base this in your research. Is there just stuff that you're seeing out there that you think may kind of fall into this space?
I would say the Japanese are doing a pretty good job with robotics when it comes to supporting older adults. Really some innovative technology that we may think is the future, but it's really, I'll find some websites and I'll post them in the chat of some tech that they have developing that are really interesting. Some of it is a little bit, I think culturally we have to accept it. It's interesting, that aspect, but lots of cool things coming from Japan.
Thank you. Yeah, Galina is posting tons of links in the chat for everyone. So if you're not looking there, look over, and I've seen your links coming across the screen. So here's one coming back to the issue of medication monitoring. We've had a few questions on this, and I think the comments on this have been so interesting. But Shiva asks, is there any existing technology that ensures us that older adults took their medication for telemonitoring? Consider the fact that they might tell lies to us or the voice assistant. So Unshim or Amanda, have either of you kind of dealt with this sort of issue? You both kind of touched on parts of this. is there tech, say if you're a medical professional, or maybe you just have, say, someone with dementia, you really need to make sure, is there tech that can make sure that they're taking that medicine beyond reminders?
Well, I think that is a tough question from the behavior perspective, but one technology, very innovative, but it's putting the sensors in the capsule. So, if no, not participants, if somebody swallow and then it'll keep track of it, in a way, that's safe way, I guess. But it's very still new technology in that sense. But the question is really relevant, but we are working on it. That's a limitation right now.
Yeah.
Good
So
question.
that's definitely the future. Yeah, or the current future, those adjustable ones that track if you've taken it. And maybe a lower tech proxy would be caps that measure if you've opened them, that I have seen. But that's different than what you're talking about, where if someone's really, really trying to convince you that they took their pills, I mean, beyond watching it go down, I do think that's challenging. But I think if you couldn't understand why, for example, is it because it makes them feel so sick, or what's the reason? And I think that could be a really useful way to address it. Because technology for kind of monitoring compliance purposes, there's a lot of stuff there to kind of, that's difficult and hard.
Yeah, this is an interesting thread that has come up in other conversations. So at the iSchool, we have a podcast called InfoZilla, which I host and kind of have these kinds of conversations in a shorter space. And I talked with Beth St. Jean, who's a professor in the iSchool, and Gagan Jindal, I guess now Dr. Gagan Jindal, who is her PhD student. And we were talking about kind of health justice issues around COVID and talking about technologies. And she was talking about, people with diabetes and how, she'll talk to these people who are like long haul truckers and they're diagnosed with diabetes and they're given a diet. And she's like, that's worthless to them because they're like, I can't, like this stuff on this diet, I can't eat it. I can go to this one diner and that's it. And so it's like the recommendation may be completely legitimate, but it's not really in line with the reality from whatever. They can't practically figure out how to do it, or it makes them feel bad psychologically or physically. And there's this real space between the medical recommendations and then the understanding of the realities that people are dealing with that allows them to kind of medically be in compliance with what people suggest for them. So it's just, that's not to answer the question, I guess, but just to point out that this is a really big problem that I think a whole host of people in this kind of health and information space are looking at. Here's another really practical one. I need to buy my 93-year-old father a new computer. Any suggestions for what to look for besides a large screen and big enough buttons? He's been using a 15-year-old computer and wants one just like it. So any specific tech suggestions? If it's a 15-year-old computer, he doesn't have an iPad. So, what we get for a 93-year-old that maybe address some issues that they may not even know that they need to address.
I was going to mention one of the other questions also talked about sort of what technology and not to break it. And I think if you really want a computer that's simple, the name kills me. It's called the WOW computer that's specifically designed for older adults. And some of those technologies can be a little bit infantilizing, but I think it can support somebody who doesn't need a lot of bells and whistles and just needs to do a couple of different options. So I would suggest AARP has a good tablet that's specifically designed for elders, and then the WOW computer.
Great. Unshim, did you want to chime in on that too?
Oh, it's just that typical, like there are large keyboards with the large keystrokes, and then older adults it's easier for them to use trackball rather than like regular mouse or the pad, because trackball is easy to control with the fingers. So there are some, as Galinda mentioned, technologies specifically designed for the adults for each piece.
Amanda?
Yeah, one other thing to consider. So there's definitely the route to go, kind of the most simplest, most accessible thing. And I see one person running Chromebook, works really well for their dad. And then another thing to consider, especially if you said your dad wants one exactly like it, is working within the same ecosystem. So some people say, oh, Apple products are so easy to use. But if someone's really used to Windows, it can be really challenging to get used to that new mental model and frustrating and not feel worth it. We worked with one person who actually set up he went into the settings and did all this stuff so that his Windows resembled like a 80 something version of it, right? So he worked really hard. He had some memory impairment, so he worked really hard to get it to look as close as possible, and that worked really well for him. So some of it is also playing around and seeing what makes sense. If you have a Chromebook that you can drop off and see what he thinks, versus is he saying, no, I need something exactly like what I've been using before.
Great, thank you. We have an anonymous question that says, can a panelist comment on the value and barrier of intergenerational connection and how technology may support it? So this is an interesting thing that we've definitely done work on in the HCI lab in the iSchool, looking at, how do you get older adults and young people kind of working together over tech. So I've certainly worked with some students on that, but do any of our panelists have thoughts on issues that come up, the value of intergenerational connections?
I can start. I'll talk about an example. At UMBC, we worked with a local retirement community where all of the internet was Comcast. So everybody's email was Comcast at comcast.net. And so a group of students and I worked together to switch everybody over to Gmail. So as you can imagine, it was lots of forgotten passwords, calling and pretending to be somebody's granddaughter. Lots of interesting aspects. And what really came out of that whole experience was being invited for cookies and coffee and connecting, really seeing the perspective of somebody else. I find a huge value in intergenerational relationships. And I think for a lot of my students, undergraduate students who may not be close to their grandparents, this was a great opportunity to connect them to somebody from a different generation. And we did self-reflections in the end, and they absolutely loved the experience. So grandparents and being connected to elders, I find huge value.
And I'll just chime in here. I had advised a master's thesis in the HCI master's program here at the iSchool from a student who was really interested in this and how to use technology to support play between, say, kids, right, 5, 6, 7-year-olds and their grandparents. And he built like one of the coolest projects that I've had from students with like little trucks and like landing, you drive the truck onto a pad and there were sensors in them. And so the grandparent could actually see, okay, oh, you moved the blue truck over here. Like, can you get the yellow truck and put it next to the firehouse? Would be able to see when the kid, even if you didn't have like a great camera set up, there would be little sensors and you could have like a game that went along with it. So, I think you can probably find versions of some of that if you just dig around in the App Store for kind of toys that are interconnected. But he did usability studies, having kids and their grandparents use this together. And I think the novel of it is really exciting. They really seem like it. And if you can have affordable versions of that that allow that kind of connection, like that's the great thing, right? That's what you want. Okay, here's a question from Carrie Lindman. How can you best support older adults who are finding their lifelong careers are difficult to maintain without technical prowess or even functionality? I see some nods. Anyone want to jump in with some thoughts on that one? And Shim, I'm going to call on you. You've got thoughts on that?
Yeah. Please repeat the question one more time.
Yeah. What about older adults who are finding it hard to kind of keep up with the careers that they've had for their whole lives because of the technology that's now required of them to use it?
Mm-hmm. Yes. That's a difficult question. Sometimes I think because older adults cannot, they quit their job because it's too complicated. But I think that the rule of thumb, I would say that older adults can learn, just adaptation. And I think they need to communicate with their colleagues, what they can do, what they can offer. And I think if the requirement is very strict and not endure the stress, then it may not be the right place. But usually if they open about it and try to learn, I think older adults, if they are able to work, continue their job, I think most of the time they can learn. And I have seen many older adults maintain basic computer skill sets, and they continue their job. But it is important that we communicate with the adults, let them know, and they try to learn too. So I think it's overcome, but it is too strict, then they need to decide what they need to do though, because they want to have quality of life.
Amanda?
This is a really hard problem, and I think one that institutions who are making these technology changes have a lot of responsibility and opportunity to address, right? Because you don't want to be losing people with these years or decades of knowledge. Like, that is a huge loss for the organization. And maybe one thing from my field that's useful is looking at it through a like workflow and practice perspective. So thinking about how the technology is changing people's workflows, and if you can prepare people to work through that. Often vendors will work with you, right, to make little adjustments to technology you're adopting. So making sure that you're explicitly including some of your really valuable employees who might are maybe skeptical about this technology and getting their voices involved. But this is another big problem, and I think also happens because we might not be thinking about this. And also, again, we need to, our values, I guess, as well.
And actually some organizations offer classes, right? Yep, for those individuals. So
I saw someone from Oates, looks like they're on the call too. I think someone said so.
And intergenerational relationships at the workplace. I think that's a great way to share knowledge.
great point.
Great, thank you everyone. So I just put in a mention of Oates Older Adults Technology Services, which kind of helps with some of the skill gaps that we've talked about, and getting access to broadband computers. I think we kind of addressed the question posed by the person from Oates who's on the conference today, but I've put that in the chat as well. So we're just at the end of our time. So I want to encourage everyone to take a look at the chat, because there's a ton of resources and links in there. We will try to get that all collated in a nice place that's useful, and find a way to make it accessible. Thank you all for the really great questions. And then I'd like to especially thank all of our panelists. This is a big topic that obviously people are really engaged with. They have all kinds of things to talk about, and you've done a really wonderful job presenting us with an overview of the research, the kind of cutting edge knowledge in this space, as well as giving a lot of really practical things for people to grab onto and take home and try out with the older adults in their lives. So thank you to all of you for the answers. Thank you to everyone for joining us today in the webinar. It's been great to talk to all of you. Thanks, and have a great rest of your Wednesday.
Thank you.